My name is Bill Whang. I'm a professor of medicine at Mount Sinai Hospital. I'm a practicing clinical cardiac electrophysiologist. The AdmIRE study was a previously published single-arm FDA trial of a pulsed field ablation catheter for ablation of paroxysmal AFib. We did a secondary investigator-initiated analysis of the relationship between PVCs early after AFib ablation and recurrent atrial arrhythmias. Our patient population involved 361 participants who were in the pivotal and pilot phases of the AdmIRE study. They underwent transtelephonic monitoring essentially weekly for the first 5 months after ablation. We performed a regression analysis of the relationship between early PVCs within the first 6 months after ablation and 1 year recurrent atrial arrhythmias. Our key findings were that the odds of recurrent atrial arrhythmia were higher in the participants who had early PVCs detected. About 37% of the participants had early PVCs, and their odds of recurrent atrial arrhythmia were about 2.1 times as high as those who didn't have early PVCs. The 95% confidence interval was 1.2 to 3.5 in multivariable analyses. Based on these results, we performed an exploratory analysis of a second trial that Biosense had conducted involving radiofrequency ablation, and we found similar results in the Q-efficiency study. So these results were consistent across the two energy forms. Take-home message is that PVCs with early after AFib ablation seem to be a marker for increased risk of recurrent atrial arrhythmias. And we don't know yet what the mechanism is of the elevated risk associated with these PVCs. Well, we definitely need to know whether this is consistent across other studies. We need to know the ideal time window to detect PVCs in terms of their predictability of recurrent atrial fibrillation. And we need to know why it's occurring in order to be able to potentially mitigate this increased risk. Potentially PVCs could be a trigger for AFib based on the lack of AV coupling associated with the PVCs.